By now, you certainly want to know what kind of results you might expect from NeurOptimal. Well, this is a tricky question to try to answer because NeurOptimal is not a treatment for any particular issue or symptom. It's not targeted to correct anything specific. It doesn't include a step of diagnosing just what is wrong in your brain and prescribing a particular protocol to correct that problem. Remember that NeurOptimal is simply looking for turbulence or wobble in the brain's dynamical activity and alerting the brain when that happens. There's no evaluation, like this wobble is bad, or direction to the brain, like change your activity in this way. Just mirroring what the brain is doing and letting the brain respond in whatever way it chooses. It may be hard to believe that simply mirroring like that can produce change, so it's time for another little analogy. Suppose you're trying to teach your child to have good table manners. You could make a list of good and bad behaviors and comment every time she does something right or wrong. But she may feel like a little robot, following your rules, but not particularly attached to them. Here's another approach. You could have your meals in the family dance studio with mirrors on all the walls. When she reaches past you for the salt and pepper, the movement in the mirror catches her attention, and she sees you suddenly grab your water glass to keep it from tipping over. After a couple of times of seeing this, she starts to reach, and then, anticipating that you're about to lurch for your glass, she stops herself and says, "Could you pass me the salt and pepper?" When you do neurofeedback in this way, it's not really appropriate to call it a treatment. So we think of it as training the brain to be flexible and resilient. That can be very powerful, and people often see great improvement in things that have been bothering them. But we can never predict the order in which things will improve. You may have been hoping that neurofeedback will help your anxiety, and it probably will, but maybe only after your sleep has improved, your rage has settled down, and a lifelong facial tic has disappeared. Having said that, I don't want you to think that it's totally iffy whether neurofeedback will help you. So let's look at just a little data. Two of our colleagues, psychiatrists at the Kingston Institute for Psychotherapy and Neurofeedback in Ontario, have been gathering data on scores of patients with severe anxiety and depression. They see such wonderful outcomes with neurofeedback that they now generally use it as a standalone intervention without medication or counseling. In the two graphs here, you see their pre-neurofeedback baselines and the changes, and these are huge, that have happened after 8 sessions and after 16 sessions. Here's another source of data. You may have seen the video on our chemobrain study that was published in Integrative Cancer Therapies in 2013. Almost all of the measures in that study were significant at the 0.001 level, which is the gold standard for research. We've also seen wonderful results with concussions and traumatic brain injuries, with some multiple sclerosis patients, though about half have experienced no change at all, with children with ADHD, with first responders experiencing high levels of stress, with people frustrated by their aging brains, whether or not they've been diagnosed with a specific condition. And of course, lots of people come to us not with a health-related issue, but simply wanting to enhance their lives. This is much harder to quantify, but we consistently hear people describing positive changes, greater creativity, more self-confidence, more comfort in their own skin, less negative self-talk, more openness to new experiences, etc. So you've watched this far, and I'm imagining you're wondering whether or how NeurOptimal neurofeedback might help you. I encourage you to give me a call at the number on the screen, or send a text, or send an email to the email address. I love to talk with people about what we've seen with this technology, and I'm happy to answer any questions you may have.